Hi, my name is Ashraful Ahmed. My case is study number 5. A 30 years old female patient visits your general foot care and draw your attention into the irregular patches of skin on her lower legs. Uh, Lower legs. She wonders if you know what the condition is, as she is quite concerned about it. Other than being overweight, BMI 28, her medical history is uh, unremarkable. So the description of the lesion will be the location. The large lesion is situated on lower leg anterior aspect of shin area or pretibial area. There are another two lesions which are situated close to medial and lateral malleolus. Size the all lesions are more than 5 centimeter, 0.5 centimeter.